librarian on a meaningful use, you know, it's a challenge, but I think it's a good thing. And what I've said to colleagues for years now, we're doing the things we're doing because they're the right thing to do. It's nice the government's paying us to do those right things. Now, having said that, it's a difficult program, and there are some challenges. There's a couple things that we've struggled with, and we would wonder about changes around. So the first is it's really an all or nothing program. So you either hit all the marks or you don't. And I would like to see them look at the idea of sort of tiered performance, you know, bronze, silver, gold. Because although we've been very fortunate and we've hit all the marks, it's a very high bar. And it's not that I think we should have a low bar, but I think the idea of tiers might, in the long run, be easier for people and more encouraging to people to achieve performance over time. The other piece that we've struggled with, and I think a lot of organizations are struggling with, is the health information exchange.
Yes. And
those requirements. And again, very important work to be done. I've seen the challenges twofold. So the first is I'm dependent on a partner for this one. So to make the requirement, it's not just something where I control the whole thing. I've got to have strong partners out there as well. And so we're concerned about some of that.
It's more complex.
It is. It's a very hard, difficult piece of the puzzle. And so where I'm going to be graded on group performance, I'm a little concerned about who some of the other members of the group might be. Will they be able to hold up their end? The other aspect of the HIE, of course, is the whole business model and who ultimately is going to fund that. So we're pretty far down the road, and we're fortunate, so we're on the Epic platform, which comes with a fair amount of built-in tools for that. So for example, we do a lot of exchange with Metro, which is the community hospital down the street. It's also the community trauma center. And then also as part of just our extended network, beginning to do more and more exchange, we're looking at the Ohio interchange as one, and then also the national interchange. And these are all requirements as part of meaningful use as well. I think that how you answer this question depends on where you are in the journey. So if you're in the part of the journey where you're basically trying to get stage 1 or stage 2 up and running, then just getting that done is pretty overwhelming. Interestingly, where we are, we were very successful with stage 1. One of the biggest challenges we have is keeping track of all the different cohorts of physicians. So we have people that are coming on when we're in mid-flight, or they may be in mid-flight. Maybe they started their meaningful use journey in another organization, now they're part of ours. So keeping track of where everyone is in that process and keeping score for all those different cohorts has become very complex for us. You know, essentially we have people...
It's a data problem.
It is, but we've got, we have this sort of constant churning of people joining and leaving, and we're moving at, we've got the organization at different stages. So getting all of that to line up properly, keeping track of it, is an increasing challenge for us. And we anticipate that's just going to get bigger as we move into more stages and as we have more people involved. I don't think I've ever heard anyone say, let's go back to paper. So I think most folks agree that moving out of the horse and buggy era into the era of the Model T was a step forward. But I also think most of us would agree, even those of us that are really passionate about this and have worked very hard, that we've fallen far short of where we want to be. Just sort of basically navigating the system, getting through my day efficiently can be a challenge for some. to some degree that's about the tools, to some degree it's about how organizations have approached training and support and ongoing training, and how much process engineering did they do on the front end. Clinical documentation is an area I think where we continue to struggle. The tools just aren't very good. The tools were designed primarily for billing purposes and for medical legal purposes. And I think it's fair to say most of these systems were designed with that in mind as well. So you take the combination of old paper-based thinking and systems that were largely designed for operational purposes, not clinical purposes, you can understand why we're falling short. Lastly, I think attention to human factors has been lacking in the healthcare space. So if you go and look at other high-performance, high-tech industries, aerospace, as an example, they've just done a much better job of incorporating what's known about human factors. How to design the systems so they fit better to the way people think and the way the human mind operates. But I think basic usability and systems that are more focused on the clinical enterprise, I think that's coming sooner rather than later. I think, frankly, that's one of the benefits of healthcare reform, is the economic model has changed. And so the incentives for using the technology and using it differently, I think, are significant. In fact, I just published a book on this subject of looking at this combination of healthcare reform, the way we get paid, opens up a whole new set of possibilities. Consumerism, this idea that our patients, they experience this in every other aspect of their lives, so why isn't my healthcare experience like that? And then the emergence of mobility, low-cost, highly mobile technology, smartphones, sensors, tablets, and the like, are all going to combine to create this very different kind of healthcare delivery system. And I think this ease of use is clearly a part of that as well.